from Assam. So, and that association comprising of students of Pakistan, students of India, students of Bangladesh. It's a one unit, international association. So I found a lot of, mainly many students I found from JB College, and that time it was Cotton College. I don't know, Prabha, you did your graduation and all, post graduation and all.
Well, from there, I was actually a commerce graduate, but I changed streams and started all over again out here in the States. So it's been a long journey.
You
so
had
Dr.
a beautiful
Mansi Sengupta is with us as well, Dr. Small, and she is the chair of the nursing program. So she just
good.
Wonderful.
You are keeping your Jappy behind you. Very good. Well, it's a simple. Even my house has got 3 big Jappies. I brought it all the way from Guwahati. Very, we had a typical, simple of Assam. We call it a Jappy, it's a cap. Village people wear it. It's a symbol for Assam. Wherever you go, you find that. So that is what I was saying. Yeah.
Okay. All right. Interesting. A couple other people are joining now.
Yeah, they will join it because it's 7 o'clock. Generally, I used to go for an exercise from 7:30, something like that, every day. I used to practice that. So that's evening. Now it's much better. In India too, the COVID cases are coming down, comparatively very low, but still cases are there, like 10, 20, like that, different places. But most of the people have, about 99% people have gone for even the booster dose of vaccination. So that may be the one reason it's not coming in that way.
Yeah, ours started to get much better after people were vaccinated and had their booster too.
Yes. Both the cases, even my institute, I was working in the DST, Department of Science and Technology. 2015, I retired as a chief scientist. So there we had a doctor, lady doctor, and she retired before me. And her son is a doctor, her daughter is a doctor, but still, both she and her husband had a COVID after second dose of vaccination, but she passed away.
Oh.
Yeah, so after vaccination also, even taking so much precautions as a doctor, still she could not survive.
Yeah.
There are so many cases like this.
We're
many good people, many good friends of mine, passed away during this COVID.
Yeah.
Very unfortunate.
We're
How is
finding
US now? Better, I think so. Very better. Situation is better.
We're finding that the majority of people now in the United States that go in the hospital with COVID are those people who are not vaccinated.
Okay. Yeah.
That other people who have gotten the vaccine and have been boosted, they may get COVID, but they don't have severe disease as frequently as before.
Yeah, very true. Very true. It's a very true case. Here also the same thing happened. There was a movement against the vaccination in the early part. But now, slowly, that has come down. Very, most of the people, 99% people are vaccinated now.
Wow. We are not that fortunate to have that many people vaccinated. We have many people who do not want to be vaccinated. So struggle.
Still people are there, that means.
Yeah.
Okay, so I just reached home. Sorry for that huge traffic today. So I just called up my Chancellor. He's also stuck in traffic, but he's going to join in 1 minute. We'll start in 1 minute. Sorry for the delay.
That's okay. That's fine.
Good evening.
Good evening.
Welcome, Dr. Lei, Assam Doctoral University.
Oh, thank you very much.
And we are indeed very grateful to you that you have agreed to deliver the talk. Most welcome. Yeah, so.
I'm very honored to be here. Thank you.
Thank you very much. Dr. Bua, you can start.
Yes, sir. So, just give me 1 sec.
Now there are several people joining.
Hello, can you hear me? I'm just using. Can you hear me?
Yes.
Okay, very good afternoon, everyone. Who joined the lecture till now, and a very good morning to Dr. Small.
Thank you.
And of course to Dr. Deka as well. So, and any other who has joined from the US, it's a very, very good morning to all of you. And let me welcome you all to the 13th lecture of the Chancellor's lecture series. And we are extremely privileged to have with us today Dr. Lei Small from the University of
Michigan.
Michigan.
I was speaking. I mean, you guys didn't hear me. I'm sorry. There's something wrong with the network. I'm so sorry. Let me start again. So yeah, so it's a pleasure to have with us Dr. Lei Small from the University of Michigan, and she is
what happened?
Are you still here? Hello?
No, it's okay. It's perfectly fine. It's okay. Go ahead.
We can hear you. We can hear you. There's no problem.
I'm so sorry. I'm hearing the reflection of my own voice, actually. So, anybody whose microphones are on, I'll request you to kindly mute the microphone. Yeah, so it's a pleasure for us to welcome Professor Small, virtually though at the moment, to our university, and hoping to see her sometime here in our university. And we got a slightly delayed, so let me take the honor and the pleasure of introducing Dr. Small. So Dr. Small earned her bachelorate nursing degree from a small college. It's called Keuka College in upstate New York, and her master's and PhD degree from the University of Rochester in Rochester, New York. With each successive academic position advancement, her passions for high-quality healthcare, evidence-based practice, and implementation of thought-provoking educational strategies has grown. For over 2 decades, she has integrated and applied these passions with the goals of impacting healthcare practices, evidence-based best practices, and stimulating the intellectual curiosity of nurses, students, faculty, and staff. She has held various successively complex and comprehensive administrative roles in nursing academia since 2004. Embracing the academic tripartite mission of education, research, and service, Dr. Small has served as a nursing educator for greater than 20 years, held multiple leadership roles in several professional nursing organizations, as well as serving colleges and universities. And she has continuously engaged in scholarship. With almost 30 years as a primary care pediatric nurse practitioner, her research portfolio is based on positive approaches to parenting, child development, motivational interviewing, and the synchrony of interactions between parents and young children. Given that foundation, she has studied child maladaptive responses to hospitalization and obesity interventions with young children and their parents. Her dedication to the healthcare of children and families has been recognized by fellowship in the National Academies of Practice, the American Academy of Nurse Practitioners, and the American Academy of Nursing. So we look forward to listening to Dr. Small, and she'll be telling us about the nursing education in the US. And I'm sure all of you will definitely benefit from this interaction with her. So I'll now pass on the platform to you, Dr. Small. So over to you.
Thank you. Thank you very much. And I'm going to share my screen. I'm not sure how things happen in India, but if people have questions along the way, you can put it in the chat box. And Dr. Dekka, Pallav Dekka, who works with me, is going to help to interrupt me and let me know what your questions are so we can respond to them as we go along. So with that, I'll share my screen. And hopefully Pallav is going to tell me if I'm in the presenter mode.
Yes, you are.
Okay.
Just switch to the presentation. I can see your PowerPoint.
Okay. Can you see that?
Yeah.
Click it once more. It's still in the layout.
Slide mode. You have to put it in the slide mode.
It's in the slide mode.
Yeah. Okay. We may have to use it in this. Oh, that would
slide
be different.
mode. Yeah, in the corner.
Yeah, hang on just a second. It's on dual screens, Pallav. That's why I'm having difficulty.
Yes. Yeah.
Give me just
there you go. That particular.
Okay.
Yeah, it's okay.
So
it's perfect.
Okay. So are you seeing slide mode or are you seeing the presentation mode
Presentation mode only. Presentation mode.
Okay.
So slide mode, it will become slightly bigger. That's all. That's an advantage.
Okay. So I was honored to have a gift that Dr. Dekka brought back from India, from you all, from the Assam Downtown University. And this is hanging up in the Dean's Conference Room. So thank you for that. And I'm very honored to have that and hope that we will find many more times that we can work together on different projects as we strengthen our relationship across the ocean. So what I wanted to start talking about is the pathways in the United States to become a registered nurse. That's what we call it here. And I did have an opportunity to look at the website for Assam University and the College of Nursing. So I think there are many similarities, but potentially things that are different. So I wanted to start talking about the foundation of education. Pallav, can you tell me if you see the advancement of the animations on the slide?
So for me, Dr. Small, it's still in the slide mode. It still haven't gone to the presentation mode.
Yeah, that's what I thought. Hang on just a minute. I want to do this a different way.
And the other request to audience members, if you are not speaking, just mute yourself at that point of time so that there's no interruptions.
Maybe Dr. Small, select the complete screen, you know, when you go for presenting.
So is that now?
That is much better. Yes.
Perfect.
Okay. Good, good. It took me a little bit, but thank you very much. I appreciate the feedback. So the foundational education in the United States starts with three components, and that is children from about 5 to 13 years of age go to elementary school. Then we have something that we call middle school. 13 to 15-year-old children go there. And then in high school, it's 15 to 18 years. And so that foundational education is usually completed at about 18 years of age. And from there, students achieve certain milestones, one of which is called the SATs, or Scholastic Aptitude Test. And that assesses students for their skills in reading, writing, language, and math. Is there a question?
Nope.
Okay. And so with that SAT, that is a standardized score across the United States, and it is specific to different people's disciplines as well, that talks about whether they're eligible for college admission based on those scores. Some other important factors includes not only their grades and the strength of the curriculum. So in some places in the United States, at different foundational education, they have Regents level courses, which are considered to be a more in-depth level course. There's also an admission test scores that you have to take different admission tests for different universities and college. And then they take into account different extracurricular activities, for example, being in the math club or other kinds of extracurricular activities. Certainly, as you all likely require letters of recommendations, a writing sample, and a demonstrated interest in the career. So with the foundation of the education behind, students need to start to make decisions about what college they want to go to. And so the first and most important thing is that students choose something called an accredited program. And I see that the Assam Downtown University is an accredited university, so you all are very well versed in this. In nursing, there is secondary education and higher education. That's what we call it. And I see from the website in the nursing area, you also have this, you title it in different ways. But you could get a 2-year degree in nursing, that's called an associate's degree here, or a 4-year degree in nursing, and that's called a baccalaureate degree. And so it's important for students to start to understand what the real goal of their education will be. And the major goal in the United States for undergraduate nursing is that they pass the National Council licensure examination for registered nurses. And we call that the NCLEX examination. And I think that you all may be familiar with this. It is one that has been accepted not only in the United States, but in Canada and Australia. In the United States, it was accepted in 1982 as the licensing standard for all 50 states. Before 1982, and unfortunately, that was just before I took the NCLEX exam, it was not accepted in all 50 states, but it is now. So this means that registered nurses who take the NCLEX exam may be educated with a 2-year degree or a 4-year degree. And so the associate's degree nurses can pass the NCLEX exam and be a registered nurse, or a 4-year degree completion can allow someone to take the registered nurse NCLEX examination. There are now programs that educate RNs with a 2-year degree to become baccalaureate prepared, and that's because in their baccalaureate preparation, there are additional courses and requirements, and it is the preferred degree in the United States, particularly for hospitals that have what we call magnet designation. That means that that's a desired hospital or healthcare agency that nurses want to be an employee of. They treat their nurses better than in other hospitals that are not magnet designated. And in magnet hospitals, 80% of all nurses must have a bachelor's degree. Once a person has a baccalaureate degree, so they've passed, and then they pass their NCLEX examination, so they're a registered nurse, they also have to have state licensure, and that is different for all 50 states. With that information or with that achievement, they can also gain something that we call a certification. And that is a specific area of focus, usually requiring some book learning and then to take a certification exam, but it doesn't necessarily mean that they have to take any additional courses. And so you can see by this slide, there's a lot of different certifications that a registered nurse could have. So for example, it could be in neuroscience, it could be in cardiovascular or mental health. Some nurses gain a certification for professional development, and that's like continuing education, pediatrics, or being a nurse executive. But that's not an additional degree, that's just a certification to indicate specialization. So then you might think, and you all have probably experienced this, why might nurses consider advancing their education? So they may want to advance their knowledge and care in a specific area. They can start to see that they had to take really difficult science courses to complete their baccalaureate education. And as they interact with other healthcare providers, they see that they actually can provide high-level quality care. Frequently, nurses who function in hospitals decide they don't want to rotate shifts any longer, so they don't want to work days and evenings and nights. Maybe they don't want to work weekends any longer or work 12-hour shifts that are frequently required in the United States. And as they start to understand more about different people's roles, they start to see that the door is open to them and they can explore many other opportunities. So they would consider then going forward for graduate education, and that may be a master's degree, and I see that you all have a master's degree that's 2 years beyond a baccalaureate degree. Or they could pursue a doctoral degree, which could be 2 to 6 years beyond a master's degree. So that can be a bit more school that they would need to consider. So then you might think, how does an individual decide what level of education they want and type of graduate education to pursue? And this is where I think some differences come into play, and I'm very interested to understand about your master's degree and the different specialties you offer. What a person chooses to do in the United States for their graduate education is really dependent upon the scope of practice that they want to have. And that means what legal acts can they perform with advanced licensure. So for example, they might write prescriptions, they might write orders in hospitals, they might order lab tests and evaluate those lab tests. So the types of graduate degrees could be a master's or a doctor of nursing practice, and I'll talk about that in a minute. But this graduate degree allows a person to have much more specialization, and they have to take a national certification examination to have an advanced scope of practice. They also must have RN designation due to passing the NCLEX, as well as state licensure. So There are 4 primary roles for a master's degree in the United States, and those for APRNs, those are a nurse practitioner, a clinical nurse specialist, a certified registered nurse anesthesiologist, as well as a certified nurse midwife. And I see that you all offer midwifery as well. But other graduate specialties could include a certified nurse educator, someone who is educated in systems, leadership, and administration, a nurse informatician, as well as a nurse care coordinator. Many people have heard about nurse practitioners. There are 8 different specialties of nurse practitioners. At the Michigan State University College of Nursing, we offer 5 different specialties. One is a clinical, one is a clinical nurse specialist. One is a certified registered nurse anesthesiologist. And then there is a family nurse practitioner specialty, an adult gerontology nurse practitioner specialty that works in primary care or in outpatient settings. And as well that we have a brand new psychiatric mental health nurse practitioner specialty. So at this point, Pallav, I thought that I'd stop and ask if there's any questions. That's a lot of information, and I'm happy to share slides.
Yes, I don't see any questions in the chat box. Request the audience have questions to just type it in, and I can relay them to Dr. Small. Maybe Dr. Small, give the audience a little bit of a background into the licensure exam itself. So does the university conduct the licensing exam? Is it through just application itself, or is it an external body that conducts the exam? Students have to pass the exam to be able to professionally practice.
Right, that's a really good question. So I think that you're asking me about the registered nurse examination. Is that right, Pallav?
Yes.
Okay, so the NCLEX examination is what a person needs to take and pass in order to be considered to be a registered nurse. And that NCLEX examination is offered by a national organization called NCSBN. I would have to really think about what that exactly stands for, but that's a different national organization that devises the tests, and they look at the validity and reliability of each individual question. So that does not come from the university, and it does not come from the state. A person must have passed their NCLEX examination and be a registered nurse in order to then be licensed within the state. And so as for example, when I moved to Michigan, I needed to apply to be licensed as a registered nurse in the state of Michigan. That was not a test, but I had to have, for example, my fingerprints taken to make sure that I had not violated any federal or local laws. That means that they had to verify that I had passed successfully my NCLEX examination, and that all other areas I was qualified to be considered to be a registered nurse within the state of Michigan. Is that helpful?
Yes, it is. And also, because the exam is externally administered, does it also place, responsibility on the academic institution to ensure that the quality of education that is being provided is meeting certain standards so that students can pass the exam?
So that's a really interesting question. That organization does not place that criteria on the universities. However, the university, as well as the College of Nursing, must be accredited. So there's accreditation of the university, but there's also accreditation of the college and each program the college offers. So for example, we just went through accreditation, if you remember, about 1.5 years ago, and all of our programs were accredited. That means that they look at our graduation rates, they look at the education and experience of every single faculty member, they look at the budget of the college to make sure that we are fiscally sound, and they look at the curriculum to make sure that we are preparing students appropriately to sit for and be successful on their certification examination for the NCLEX examination. And currently our pass rate, I'm very proud to say, is 93% of all the students who graduate from Michigan State University College of Nursing. But the national pass rate is really down into the mid-80s. So you can see we are doing a really fantastic job with our students.
So, which in a way also tells you that this exam is not easy. And at the same time, I think the 93% is the first time exam taker percentage. So students eventually get through.
Are very gracious. They actually reach out to each individual to help them to study so that they will be successful after that. And so our pass rate overall in all the times that they take it is 100%. You're right.
So the other question I wanted to ask you, and I think a lot of students who might be in the call are possibly interested or may become interested in it because they are already in a baccalaureate program.
Mm-hmm.
What's the key difference between a master's and a DNP program, and how uniquely do they prepare the graduates to be performing their roles?
Okay, so I'm going to advance the presentation and we're going to talk a little bit about that so that you can, I think that your questions will be answered, but if not, I want to make sure to revisit them. So in the United States, as Dr. Deca just indicated, nurses frequently will want to achieve a terminal degree or a doctoral degree. And we're very fortunate here that we have 2 doctoral degrees as of 2005. So what are the options and how does a person decide? So a person needs to decide on which doctoral degree because of the focus that they want to have in the future. So the focus of the education, as well as what do they want to do every day professionally after they graduate. So in nursing, as I said before, we have something called a clinical doctorate, which is a doctor of nurse practitioner, a doctor of nurse practice. It's not a nurse practitioner. Any nurse educated as a baccalaureate with a baccalaureate degree can go on to get a DNP or a clinical doctorate. And then there's a research doctorate, and that's what Dr. Deca has, is he has a PhD. He is a nurse scientist. And so the difference is really about the education that's provided as well as the practice that's expected following graduation. So the education for a clinical doctorate is focused on evidence-based practice and the ability to read and understand the research, quality improvement, healthcare policy, and healthcare finance, but it oftentimes has a specialty focus. So for example, I'm a pediatric nurse practitioner, and so I have a specialty focus in pediatrics, in primary care, or in the outpatient non-hospital area. But a PhD is a research doctorate, and so a person also needs to know how to review and understand the research evidence, but decides or finds gaps in the research that we really need to close and understand in order to improve our ability to practice and develop. Individuals are educated about how to develop rigorous scientific study. Those individuals, their practice is really going to focus on the production of grants in order to get grant funding to do their research. Does that answer your question, Dr. Daka?
Yes, it does. And just to add to what you said, what you already said is that, an individual who is motivated enough can actually have both a DNP and a PhD. So it's very similar to doctors who are MDs, but also have PhDs who want to do research as well.
Yes, exactly.
I have a couple of questions, Dr. Small.
Okay, go ahead.
What prospects are there for bachelors of nursing graduates from India to go for study and employment in the US? And kind of associated with the same question is, are there any scholarships available for international students to study at MSU?
Yeah, so there are, one would need to come to the United States and take an NCLEX examination to be considered a registered nurse in the United States. And so it's difficult for me to know if the educational preparation, I would imagine, because it seems as though it's very similar, would prepare a person to sit for their NCLEX examination to then be able to be a registered nurse, and then would need to be licensed in a state where that person chooses to practice. Does that answer the first question?
Yes, it does. An additional requirement for an international nurse would be to secure a visa that would allow them to work in the US as well.
Yes, yes, and I think we've also seen that because we have some people from Canada who actually want to become educated in the United States, and we have a new faculty member from Canada, and that's actually considered an international individual and would need to have a visa. Yes, that's correct. And then with regard to scholarships, there are scholarships that are available if a person applies to a college. Whether they're specific to international students, I'm not as knowledgeable about that, but I'm not necessarily aware of ones specific to international students at Michigan State University College of Nursing. However, there are many scholarships that are available, and every student who is admitted and enrolled in the program at the College of Nursing is eligible to apply. Do you have more information about that, Pallav, or did that not answer the question?
No, you did. And just to add that, being an international student myself, there are different opportunities from the university that are available. And it could be at the university level or the department level. And also, additionally, if you're enrolled in a PhD program, then often you can be funded through a faculty member's grants if the grant allows for that kind of money that is built in to support a student. The other question I have is, can a Bachelor of Science or maybe a commerce student opt for a nursing degree in the US?
I'm sorry, I didn't catch the last part of it. Can a Bachelor of Science individual what?
So essentially, the student is asking if a student with a bachelor's in a different field pursue a nursing degree in the US.
They can pursue a nursing degree. There are two ways to do that. One is to go and take a traditional nursing program. So for example, we offer a traditional nursing program. So the first thing is one would need to be accepted or admitted into the university, and there are certain requirements. So some of the courses an individual might have had. So biochemistry was one of them. We were just talking with one of the faculty members about. Those could be transferred into the university. And then dependent on what courses were transferred, would identify what other remaining courses a student would need to take. And they could do that in a traditional nursing program. And in the College of Nursing, we are considered a professional nursing program. So after the university requirements are satisfied, It's a 2-year program, and it's only offered in the fall and in the spring for 2 years. But there's another option, and that is to gain an accelerated admission, and that is a 15-month program where students take many more classes in a much more facilitated way, and in 15 months are eligible to take their NCLEX examination. Is that helpful?
Yep, it is. So essentially, for any student who has a baccalaureate degree in other fields, they can pursue nursing degree in the US as well. And depending on their background, there could be courses that can be pulled over as, meeting the requirements of the nursing program itself.
Yes, exactly.
Another question is, why don't you suggest Fulbright scholarship for nursing fellows for the short term? Maybe for a different talk, Dr. Small, but you can add this in.
Oh, I'm not sure that I can answer that, Pallav. I need to look a lot more into someone being a Fulbright scholar, but I am happy to do that. If you take the name of the individual and their email, I'm happy to look into that and get back to the person, okay?
Sure.
I'm just going to move forward a little bit, if that's okay. I thought that I would indicate the percentage of individuals who are nurses and the various levels of education that they've had in the United States. So currently we have 4.3 million registered nurses. That means they've taken the NCLEX examination. And of all those nurses, and these are all the baccalaureate prepared nurses, 45.2% of them have a baccalaureate degree, 17.1% have a master's degree, 1.2% have a Doctor of Nursing practice degree, and in the PhD in nursing, specific to nursing, only 0.6 of all the nurses in the United States have a PhD, and 0.1 may have a PhD in another field. So for example, if an individual is a registered nurse and maybe they have a master's degree, they could get a PhD in a different field. And I think that that's true also in the Assam Downtown University when I look at the website. And the PhD could be in sociology, or it could be in I'm trying to think of another PhD, and that escapes me right now. But one does not have to have a PhD in nursing, but could get a PhD in a different field and still practice in nursing and do nursing science. So professional nursing practice and nursing science are integrally related to one another in the United States. And I think I see that interplay exist also in India when I look at the website. I wanted to just briefly talk about recent changes that are impacting nursing education. And that is the change to competency-based education across all programs. And I don't believe that's currently what is happening in India when I read the website. For example, the outcomes of a course or the outcomes of a program are frequently decided upon based upon the faculty and what they think is the best outcome. However, that's going to change and shift in the United States. We were just told at the end of last year that we have to focus on competency-based education. And that means that competencies were decided by the accrediting agency in working with people in hospitals and healthcare agencies and organizations, as well as colleges of nursing, to decide what all registered nurses need to be competent in doing, so that the outcome of getting a baccalaureate degree is similar and can be expected by healthcare agencies. So that means that students would need to demonstrate that they are competent in a skill or multiple skills at various points in time in their education. So it's not good enough any longer to just learn a skill and learn some information in one course and not transfer that to another. Additionally, we have brand new criteria that just came out this week for nurse practitioner programs that are requiring more clinical hours, as well as some other things. And I think Dr. Decca, who is a nurse practitioner, and I are still reading through that very long document to see what has been changed or is new and is a new requirement for nurse practitioner programs. And with that, I'm going to move forward quickly and somewhat briefly to the current state of nursing in the United States. I have seen in the news that India was very, very affected by the COVID-19 pandemic, as we have been as well. And it's been really hard for nurses in the United States. So currently, before the pandemic, we had critical shortages of registered nurses in different areas in the United States. But with the pandemic, now we are in a critical shortage across the nation, and we're expecting that to exist until the year 2030. So we have many more years of this critical shortage. This was in part caused due to the high stress and fatigue and concern for illness that came along with the COVID-19 pandemic, and I'm sure that you all have experienced that as well. And it has caused many people to leave the profession. They don't want to work as a nurse anymore. As a result, there are so many shortages that a new category of nurses has grown. It existed before, but not many people chose to be a travel nurse. But now there are many people who are choosing to be a travel nurse, because travel nurses, this is a person who's hired by an agency and they're told where they're going to practice. So it could be in Texas, it could be in Connecticut, it could be in California, and in different healthcare agencies. And those travel nurses are making anywhere from 2 to 3 times as much money than nurses who are hired by hospitals and healthcare agencies. So the nurses that are choosing to stay in the profession are seeking those high paid positions, and I can understand that. However, they don't have a very high commitment to stay in a healthcare agency. The outcomes of the patients are not as good as those nurses who stay employed by a hospital or a healthcare agency. And the recidivism of nurses is much higher, because when they have to work with agency nurses who are not committed to the nursing profession or to their hospital, it's very difficult for them to experience that. And so a potential solution that we might think of from the university perspective and from the hospitals would be to fill the need with new nurses. But there's a challenge with that. So what we saw during the pandemic is that the applications to baccalaureate nursing programs increased significantly. So you can see the percentages on the screen, but they increased a lot of applications. And so you would think that we would be super excited about this and ready to take in way more nurses. However, there are challenges associated with it, because when there are nursing shortages, there are nursing faculty shortages, and that has gotten worse. There's a shortage of clinical sites, because so many units were closed to student nurses because they were COVID units, or the acuity of the patients was so high they really couldn't take any students on the unit. Or there are so many new nurses or travel nurses that are unable to work with student nurses. And as a result, over 80,000 qualified applicants to baccalaureate nursing programs had to be turned down. There are a lot of challenges to retain nurses in the healthcare setting, and we've already talked about some of them, but some of them have existed for a long time. So the physical demands, well, in a 12-hour shift, nurses generally walk 4 to 5 miles and lift 1.8 tons of weight every single shift. It's so it's physically demanding as well as mentally demanding. It's a fast-paced work environment with high patient acuity. And with COVID-19, there were many frequent deaths. And prior to that, there were less frequent deaths. And so nurses were able to grieve the loss of their patients and move on. But now, during COVID-19, and I shouldn't say now because it's much better right now, but there were all multiple patient deaths on one shift, and that really aggravated the mental wellness of the nurses on the units. Additionally, in the United States, nurses are usually expected to work 12-hour shifts, even though the mental acuity of nurses oftentimes has been identified by research to be 10 hours. During the pandemic, because it was an emergency situation, nurses were required to work overtime, not more than 12 hours, but they were frequently called in on the days that they weren't expected to work. And there were requirements to work during planned time off or vacation time. So they might be told that they can't go on vacation because they have to work. Some nurses are very fearful of COVID-19 for themselves and their families. There are stories of nurses who were sleeping in cars because they did not want to go into the houses where their families were because they didn't want to risk that they would infect their families, or removing their clothing and showering immediately upon going home and before interacting with anybody within their household. The other thing that has been difficult is that nurses who are early on in their career are oftentimes required to take on leadership roles very early because we don't have enough nurses. And so I thought that I would give you some statistics related to nurse retention. And I hope that you don't see these statistics as disappointing or concerning. It speaks to me about things we need to do differently. So currently in the United States, approximately 33% of registered nurses leave nursing in the first 2 years. The nurse turnover rates can be related to the patient care that's required, the physical demands of patient care, that staffing patterns are not aligned with patient acuity, because as patient acuity has increased, the staffing patterns have not been changed. In the United States, we have a problem with overweight and obesity, and patients are 100% heavier than they were 30 years ago. And this puts physical strain on nurses. Additionally, and this may not be related fully to nurse retention, but right now it costs healthcare agencies and hospitals anywhere from $100,000 to $200,000 to train a new nurse graduate who is an RN. So there's training that has to happen past the education that the students have. And there's a struggle for those new nurses, as I said before, to train student nurses. So we are currently at a tipping point in the United States, and that in our language means it's a point at which a series of small changes or problems have become significant enough to cause a large, more important change that must occur. And so we have to try something new. Things that we did before may not work in this crisis situation, and so we're considering different strategies. For example, at the Michigan State University College of Nursing, we're trialing different ways to train nurses so they're much more prepared to be on the clinical units, fully functioning as a nurse upon graduation. And that wasn't always the case before, because in their last course, they were providing total care, but only for 3 to 4, maybe 5 patients, where a nursing load of patients is usually anywhere from 7 to 8 to 10 or 12 patients. And so that required a lot more training. So we're trying to ease that transition. So with that, I'm going to end this presentation, and I'm happy to share these slides. As Pallav knows, I am not a negative person. I'm a very positive person. And so with these challenges, I actually see lots of opportunities where we can try some new, exciting things and ways to prepare nurses to be in the clinical environment. And so with that, I'm seeing that there are some questions, and Dr. Decca, I will ask you to help me with that.
Sure. Okay, I have a few questions coming in, so I'll read you the first one. I read that in a recent study conducted by nursing faculty at the University of Pennsylvania School of Nursing, researchers found a large number of nurses are unhappy. What do you feel is the reason for this? Are hospital authorities considering making the work environment better for nurses?
Yeah, and that's one of the ideas that I think that we can explore and work on. So it isn't all about pay, right? It is, do nurses really need to lift 1.8 tons in a shift? Or is it that there are other ancillary healthcare providers that can help with that? So for example, we have certified technicians here in the United States, and maybe we need to expand the use of them. And there are other ways that we can consider. Maybe it is about increasing the quality of the food, or giving people longer breaks, or maybe we go back to having 8-hour shifts instead of 12-hour shifts. So there are lots of different ways that we can think of, but it isn't all the responsibility of the healthcare agency. It's also in the colleges of nursing. One of the things that we have been working on is really helping students to learn how to take care of themselves emotionally. So I see that you all have, for example, a very large yoga studio at the university. That is one way to take care of yourself, to really find ways and times that you can get away from the stress and strain of employment to become a more resilient individual. So yes, I agree, there are unhappy people, and there are ways that we can address it. So a research study finds a problem, but then researchers and nurses need to find ways to address the problem.
So Dr. Small, maybe you can throw a little bit of light into this, because for me, coming from Assam, the one thing I found very different when I came to the States, and especially after I joined the nursing profession, is how nursing is viewed by the general public here in the States. And how, for the last 20-25 years, it really has been the most respected profession among all professions. So can you throw a little bit of light into that issue?
Yeah. I think that I'm very proud to be a nurse. And one of the things nurses do is we must have empathy with our patients, right? Not sympathy, but empathy with them. And we need to know how to take care of them. And as a result, we help patients go through some of the most personal challenges that they will face in their lifetime. And so for me, to have the public vote us as the most trusted profession is really an honor, because physicians oftentimes are very busy themselves. They stop in, they write orders or whatever, and then they leave. But it is nurses that work with the patients, and that's why we're regarded as the most trusted and honored profession in the United States. And I'm very proud of that.
So another question I have is, I observed that the nursing sector in the U.S. is dominated by nurses from other countries and few from the U.S. itself. Okay. I'm not sure about the statistics on that, because I still think probably larger than 90% of nurses in the US are from the US.
So that many of the nurses are. I don't have a statistic on that. There are some people who come from other places to be nurses in the United States. And there are nurses in the United States who go other places to be nurses, right? So I've had friends that have worked in Dubai and have worked in Africa and have worked in Europe in different places. So I don't know the statistics on that, and I don't know if the satisfaction rates are any higher with those individuals. Nursing is a hard profession. It's mentally fatiguing and it's physically fatiguing. But I think that if we're more resilient, if we can grow our resilience, I think nurses will stay in nursing longer.
Just quickly to add to that, one of the reasons why international students or people from other countries filled the nursing profession in the late 90s and early 2000s was also because of immigration policies that the US government had. So until 2009, nurses from outside could actually come to the US with a green card. Which was changed in 2009. So we did see a huge shift in how nurses were coming from the outside to practice here in the US. Another question I have is, any personal experience during the pandemic that you would like to share with us? I think, Dr. Small, you started your position here at Michigan State right when pandemic hit. So I'm sure you can throw a lot of light into that question.
Can you repeat the question for me one more time, Pallav?
Your personal experience during the pandemic.
Oh, so my personal experience is not necessarily as a traditional nurse. I've been in education for 20 years, and so that's been the majority of my experience, although through about half of that time, more than half of that time, I also functioned as a pediatric nurse practitioner. So my experience in the pandemic would be different than other people's. However, I came from the University of Colorado at the Anschutz Medical Campus, and I was the Associate Dean for Academic Affairs there, and came to Michigan State on July 1st of 2020 to be the Associate Dean for Academic Affairs here, because I really looked for the integrated philosophy of Michigan State University, and I took over this position on November 1. So I can tell you, as a faculty member, the experience of the pandemic has been incredibly difficult. We've needed to assure that all of our students are vaccinated and boosted, which requires some effort, because in the United States, people had choice about that until a little while ago. Additionally, when hospitals were put in emergency mode and COVID units were declared, nurses were not able to be there. So it was a lot of shuffling to make sure that all of our students had the required experiences. As well, at Michigan State University, the first COVID positive student was in the College of Nursing, which required everyone at the College of Nursing to quickly leave and then figure out how to do all the education online, which was a big challenge. And I wasn't there for the beginning of it, but I was certainly there during the rest of it. So I would say it has taught us all to be flexible and to provide people with a lot of academic grace, because people weren't always able to complete everything on time the way we used to require. And so we've needed to be really thoughtful and careful about extending deadlines and things like that. So that's my experience.
It's been quite a challenge for not just you, I think everybody at the college, and including downtown university as well, because they went through the same process, I believe. Okay, I have another question, but it's directed to me, Dr. Small.
Okay.
It says, you're from a commerce background. How did you think of moving into a career in nursing? A PhD in nursing science by a commerce grad seems like a very courageous step. Well, it is, but I think sometimes you are also the product of your circumstances. So my first degree in the US was not nursing, it was a master's in exercise science. So I'm also a trained exercise physiologist. And I guess it was transitioning from exercise science to nursing that happened for me. And I had to go through a baccalaureate education before I joined the PhD program. So it was quite a process, but I think I'm glad I had the courage to take the step.
And I think that you were well prepared before you got to the United States, which allowed you to explore different opportunities, Dr. Decker.
I think I'll say in that man is a product of his circumstances.
How strong your PhD program in nursing sector in US?
How strong is it?
How strong the PhD programs in nursing sector in US?
In the nursing sector, I'm not sure I understand that. Dr. Decker, can you help me?
Nursing sector means in the nursing in India, hardly a few goes for PhD programs in nursing. Either it may be UG or maybe PG. Very few goes for PhD programs in nursing sector. That is what I'm asking. How strong there in US, in different continents, there in the US?
Yeah, so as I shared on that one slide, only 0.6% of nurses go on to get their PhD. That number has been pretty stable. The number of nurses that have gone on to get their DNP, which is a clinical
diploma,
that has increased quite a bit. But the PhD has really remained pretty flat over years. The pandemic really hasn't changed that very much. And part of that, I also think, and Dr. Decker, put your hands up over your ears right now, but funding in the United States is very difficult right now. So I think that is also makes it very difficult for people to make that choice. I will say at Michigan State University, we are quite proud to say that there are lots of internal grant opportunities and several state and regional opportunities. So, yeah.
Thank you.
Dr. Small, I'd like to add something to that point as well. In the US, the unique thing about masters or a DNP and a licensure and advanced licensure, you're literally practicing as a doctor in India.
Yes.
So the incentive to join a PhD program versus a practicing program where you could actually earn more money and is limited. So I think a big problem for any professional degree where students can get good jobs, professional jobs right out of a bachelor's, or can even advance themselves further with a master's, the incentive to join a PhD is much lower. And that would be true not just for nursing, but for any professional program.
Yeah. And I will say, as a pediatric nurse practitioner, I functioned with many other physicians, and my own patients that I took care of.
True.
It very difficult to give that up, but I was very focused on the problem of childhood overweight and obesity, which is why I got my PhDs.
Good.
It sounds like bring things to an end. Is that what I'm thinking?
So, well, that was wonderful interaction, Dr. Small. So we really appreciate you giving your time, your valuable time. Before we end this session, would our Honorable Vice Chancellor like to say something? Professor Talendra, sir?
Yeah. Like my video has some problem, bandwidth problem. Thank you very much, Dr. Lay. It was a excellent presentation, informative presentation. Before I just want to ask you, when you said your PhD program is 2 to 6 years duration, do you mean the clinical doctorate takes less time than the PhD research-based program?
Yes, the clinical doctorate is generally from a baccalaureate degree, usually takes about 4 years, sometimes a little bit more than 4 years. but a PhD after a master's degree takes at least 4 years, and it can be until the person's foundational study is completed, which is why I said, and it could potentially be more years. I was very fortunate, and I was completed with mine in 5 years, but I was very focused on getting done. And not everyone has the opportunity to not work and pursue a PhD, and that's very difficult. And I don't know, Dr. Deca, if you want to offer your experience.
Yeah, so I think the other thing that the audience and especially students should also know about MSU's PhD program is that we do offer a BSN PhD track. So you need not necessarily complete your master's before joining a PhD. You could have your bachelor's and enroll in integrated master's program, which would lead you from a bachelor's to a PhD. So when you graduate, you do not get a master's, but you graduate with a PhD.
Right. Yes. Yeah, thank you for clarifying.
Thank you very much. I have another query. Like when you say that to train a new graduate nurse, you gave a range of expenses from $1 to a very big sum. Like, what does actually mean? That like you have some $1 to like the range was too big. Like it may range from a single dollar to a huge amount of money. Why it is like that? Like I couldn't follow that.
Yes, and that perhaps is because I didn't put it well on my slide. It's about $100,000 to $200,000 to train.
Okay. Sorry, thank you. Thank you so much for your time and agreeing to deliver the talk. And we look forward to exploring some collaborative activity when Dr. Deca visited here. So we had some preliminary discussion with him, and then the mail you wrote. And thank you very much for the appreciation of our gift and for displaying in your faculty corridor. So we're so happy about it, and we look forward to some collaborative work in the future. Dr. Deca will be the link man between Michigan State University and Assam Downtown University. And I also extend a very heartfelt thanks to Dr. Deca because he has taken a very, very intense initiative that this lecture comes to finally fruition. Like finally, it has happened, and I think this is the beginning. We can explore more for future collaboration. Thank you so much, and we'll be in touch. Thank you.
Oh, thank you. And I do look forward to many opportunities that we can listen to you all, and that we have other scientists and other expert clinicians who can talk to you. One of the national here at MSU is actually the president of the National League of Nurses, which is encompasses about 60,000 nurses. And that person talks frequently with politicians at a very high level about nursing, as well our Associate Dean for Research, who Dr. Deca speaks with all the time, just was installed as the president of the National Organization of Nurse Practitioner Faculties in the United States. So we are very, and I'll say blessed, to have very prominent people in the College of Nursing, very proud of them, and I'm sure that they would share their expertise and wisdom in multiple different ways with you all. So.
Thank you so much. Dr. Borua,
thank you so much, Dr. Small. It was wonderful listening to you, and I'm sure all our students who have attended this session, they got to know a lot about the nursing education as a profession in the US. And hopefully we can sometimes get your students and our students connected. I don't know how, but maybe we can somehow think about some type of interactions with them, maybe virtual initially. And we do look forward to welcoming you in our campus here. It's a very beautiful part of India, the northeastern part of India. And you should visit it sometimes. I'm sure Dr. Deca will inform And we are famous for the SMT, and we are famous for the one-horn rhinoceros. So, we'd love to welcome you one day, and then it will be another wonderful interaction with you, with our students, face to face. So we look forward to that, Dr. Snow. Thank you so much, and
All
also
right.
special thanks to Dr. Decca also for facilitating.
Thank you. Thank you. Thank you.
Thank
Really nice.
you.
Thank you. Thank you.
Yes. Bye.
Thank you very much. Bye bye.